Science shows that building resilience and skills such as patience and happiness are important for the development of children. In this video, Dr. Rick Hanson, a renowned psychologist, explains what resilience is, how we can develop resilience in ourselves and young children, and 3 steps we can take to become more patient teachers and parents. So let's talk a little bit about resilience. So first of all, how would you just define resilience in general?
Right. I would define it as having 2 aspects: surviving the worst day of your life and thriving every day of your life. In other words, resilience is what we have inside us that enables us to handle challenges to our needs or the needs of others while staying on an even keel, even as the waves of life come through. And the purpose of resilience certainly is coping, but the purpose of coping and resilience generally is well-being. Resilience is a means to an end. It's not just an end in itself. And I think sometimes people make 2 kind of mistakes these days when they think about resilience. First, they think about it as only being relevant to trauma. Well, it's relevant to trauma, the worst day of your life, but it's really relevant to everyday functioning and moving forward through stresses and obstructions, including with other people every day. And the other thing that people, I think, often misunderstand about resilience is that they focus on it in terms of a kind of grim, fortitude. And if you're not miserable, you're not really paying attention, right? And the point of resilience is to help us be happy, a deep, fundamental inner peace and contentment and love. That's what I mean by happiness. And that's the point of resilience.
Right. Lovely. And when we think about a resilient mindset and a kind of non-resilient mindset, can you give us some of the characteristics?
Yeah, great. So if lasting well-being in a changing world comes from resilience, as well as some other things, but resilience is necessary for lasting well-being in a changing world. What is necessary for resilience? Resilience comes from psychological resources inside us, like determination or gratitude or skillfulness with our own mind or with other people, or self-compassion or self-worth. That's where resilience comes from. So the question then becomes, how do we get those inner resources inside ourselves or inside our children, or even helping other adults to acquire these over time? About 1/3 of who we are is innate, and its causes are innate, based in our DNA, essentially, in our biology. The other 2/3, though, in principle, is what we acquire over time, which is both very hopeful, but kind of old school because it takes us to responsibility. No one can stop us from acquiring more inner strengths, inner resources over time, but no one can do it for us. So my own work, as you know, is very focused on that fundamental process of acquiring, of developing, of growing the good inside ourselves, how to actually do that, and then apply those general methods of growing the good to growing any particular things you want to develop in yourself or inside your children.
I think that's wonderful because it gives everyone hope, doesn't it?
Totally.
We can all, grow and get better and develop these skills. So I think that's really important for people to know, because some people do think it's that they can't change, but actually I think everybody can if we just learn how. So that's
and as you know, I have a special interest in the neurological basis of personal development. And I'm pointing at my head because that's the primary location where the physical basis of change for the better occurs. But it's really the whole body, including especially its nervous system, that's involved in the change process. And it's really inspiring, as you say, for people to appreciate that their mental practices, just like, you can build a muscle through physical practice, you can build inner resources like happiness or self-confidence or patience with others, including your children. You can develop these things in yourself
Yes.
which involves physical changes inside your own brain and body.
Yeah. So let's talk about the patients one, because we have lots of teachers and parents of preschoolers watching. So how can they themselves or and me develop more patience and more kind of in towards the kids that we're working with, or towards our own children? Moment,
Well, first let me frame my answer, if I could, with two little points, and then I'll get into the practical of this. The first frame is to recognize, of course, the world around us and our physical bodies make a big difference, right? So before I talk about how to change the mind for the better, I want to just acknowledge that it's really important to change the world for the better and to protect the physical health of yourself and other people. Sometimes people think that if you focus on the mind, that means you are accepting the world as it is with all its problems and not dealing with it. I say, no, we need to do both. We need to help the world. We need to help ourselves. First point. Second, my own background, which you know some of. My doctoral dissertation was on 15-month-olds. I'm extremely interested in the 0 to 3 period and children in general. I've done a lot of child therapy. I've worked in a lot of schools, including a lot of time in preschools. And I think there's a special place in heaven for school teachers and educators in general. So that's my own kind of background here. So now let's talk about the fundamental, I'll say it in a fancy way, the fundamental neuropsychology of learning, and learning broadly, including healing, developing, transforming, growing. What's the fundamental neuropsychology? It's summarized in this famous saying, neurons that fire together, wire together. It's a two-stage process. First, we must experience what we want to grow. We must have experiences of patience if we want to develop more patience, or experiences of factors of patience, like relaxing the body, or putting things in perspective, or feeling supported and protected by other people, to name a few factors of patience. We must experience them. We must get those neurons firing together first. We must have the experience. But second, critically important, we must help them wire together. Otherwise, they're firing. The experience is wasted. Wasted on the brain. It might be momentarily better than the alternative, but by definition, if there's no wiring, there's no lasting value. And that's the dirty little secret in parenting and teaching and being a therapist or a coach or a mindfulness teacher, all of which I do. If we do not pay attention to the wiring together phase of the development process, we are missing so many opportunities to harvest and get the most from our experiences. So from a practical standpoint, I'll say 3 ways that are neurologically based in research that people can use with themselves and with their children and with their friends to help experiences have the most lasting impact, and to help themselves steepen their growth curve as they go through life. 3 simple ways to help those neurons wire together. Ready? Okay, 3. I can remember 3 things. 4, I have to write them down. 3, I remember. So 1, stay with the experience for a breath or 2 or longer. Keep those neurons firing together so they have a chance to start wiring into you, literally hardwiring into your own body, the benefits of the experience. Stay with it rather than getting distracted or scooting on to the next thing. Second, try to feel as much as you can in your body. The more that, as every teacher knows, the more that an experience is embodied, the more that it's sensed, the richer it is emotionally, even the more there's action involved with it, including subtle actions of posture and facial expression, the more the experience will sink in. Feel it in your body. The third suggestion is to focus on what's rewarding about it, what's enjoyable or sweet or meaningful or heart-touching or inspiring. And the more we focus on what's rewarding about an experience, the more that engages systems in the brain, especially those involving neurotransmitters, dopamine and norepinephrine, which therefore flag the experiences for prioritization. They prioritize the experiences we're having when they're rewarding to really help them go into long-term storage. So the essence is really simple. Stay with it, feel it in your body, and highlight what's rewarding about it. And when you do that for a half a dozen or a dozen seconds in a row, or even a little longer, a few times a day, you will be making substantial beneficial changes in your own brain that will benefit you the rest of your life.
Right. Wow.